people have neurogenic bladder, the nerves that go to the bladder to allow you to empty your bladder on command are either damaged or diseased. This leads to people being unable to completely empty their bladder on their own. We often refer to this condition as urinary retention. When you have urinary retention, the bladder must be emptied to allow urine to exit the body. This is important since urinary retention can lead to infection or back pressure to the kidneys, so the urine needs to be emptied. There are 3 ways that a bladder can be drained. The first way is with an indwelling Foley catheter in the bladder that is placed through the urethra. A second way is a suprapubic catheter that is placed surgically through a puncture site in the abdomen. And the third way is with clean intermittent catheterization. Suprapubic catheters and urethral Foleys require you to have a catheter in at all time, draining to a catheter bag. These increase your risk of bladder infection and bladder stones. In the case of Foley catheters, they can irritate or even damage the urethra long term and can be uncomfortable. Some patients also find wearing a urine bag to be inconvenient or embarrassing. Also, these indwelling catheters have to be changed routinely, usually every 4 weeks. Clean intermittent catheterization is also called in and out catheterization. It is an extremely safe and the most recommended way to empty a bladder in retention long term. The bladder is emptied between 4 to 7 times a day, depending on how much your bladder holds and how much fluid you drink. To do clean intermittent catheterization, first get all the equipment you need, and then wash your hands. You will need the correct catheter, some lubrication, a cleansing wipe or washcloth, and a container for urine, which can be a toilet or a urinal. Next, the urethral area is wiped to remove any bacteria. It is important not to use harsh cleansers like betadine or alcohol, since these will irritate tender tissue. The catheter is removed from its package, and if it's not pre-lubricated, then add lubricant to the tip. Next, the catheter is gently placed into the urethral opening and advance with gentle, constant pressure until urine in the bladder starts to flow out. In men, it is helpful to stretch the penis to make the urethra tube straighter. In women, it can be hard to find their urethra, and some women find it by feel or with a mirror. Urine from a catheter drains more slowly than urinating, so you need to be patient and allow it to completely empty. When it is empty, pull the catheter out slowly to empty any small amount of urine that is left behind. Finally, throw away the catheter and wash your hands. Some people have a hard time catheterizing themselves because of spasticity or body shape. In women, it can help to lay down or have someone help you get positioned. Some people have limited use of their hands and need someone to help them with catheterization. Other people can use special hand-assisted devices to allow them for better grip on their catheters, or may need help positioning their legs. Catheters come in many shapes and sizes. Women often use shorter catheters and men longer. The French size of a catheter indicates how big it is in diameter, with most people using a 14 French, but the smaller 12 French can be helpful for some people, and a bigger 16 French can be easier to manipulate and drains faster. Catheters can have a straight tip or a curved tip called a coude catheter. Men may have an enlarged prostate, and a curved or coude tip catheter can be used to help get around the curve of the prostate. Also, the area of the sphincter just before the prostate in men can be in spasm, and being gentle and waiting for the spasm to relax can make catheterization easier. Catheters also come in silicone and latex varieties. Some come pre-lubricated with a slippery coating all along their length to allow smooth easier insertion. Also, some catheters come with a bag attached to the end, so you don't have to worry about catching the urine as it drains. Every person is different, and you and your doctor or nurse can work to help you learn the best type of catheter for you. You will be paired with the right catheter for you at your clinic visit. Some problems can arise in people who catheterize. If you run out of catheters, you need to get more as soon as possible. Call your medical supplier urgently or your urology clinic to get more supplies. In an emergency situation, you would need to go to the emergency room, so it is definitely better to be aware of your supply at all times. Some patients get bleeding when catheterizing, and you should definitely discuss this with your urologist if it were to occur. Ways to avoid trauma to the urethra tube when catheterizing are using pre-lubricated catheters, and in men, a Coude catheter, since usually the bleeding comes from the prostate area. Leaking between catheterization is a problem you need to discuss with your urologist. This is either because your bladder is overflowing when it is full, or because of bladder spasms. Monitoring your fluid intake so that it is not too much and at a steady rate throughout the day instead of all at once is very helpful. Also, doing your catheterization more often and on a scheduled basis can keep you from leaking when your bladder is too full. Your urologist can also help with treating bladder spasms. Oral medication can calm bladder spasms and make the bladder hold more. If these are not effective, then bladder botulinum toxin injections can be done to eliminate these spasms. Many patients with neurogenic bladder get urinary tract infections. Although self-catheterization is a way to empty the bladder that has the least infections, these can still occur. Things that make infections more likely are not doing good hand washing before cathing and not cathing often enough. Some people get improvements when they use a pre-lubricated or no-touch catheter types. Catheterizing less often backfires and causes leaking and actually makes infections worse. Talk to your urologist about other ways to prevent urinary tract infections. A medical emergency happens when you cannot catheterize yourself. Often this is due to muscle spasms, and taking your time or simply coming back to cath in 10 to 15 minutes is all that is needed. If you still cannot put your catheter in, get help from your family or caregiver, since laying down or doing different positions and using lots of lubricant can fix the problem. If none of these work, call your urology provider immediately, or you need to present to an urgent care or emergency room. Your urologist recommends clean intermittent catheterization for all patients who are able to, since it is the most recommended and safest way for patients who can't empty their bladder on their own.